So good morning. We're going to start the session. Our first speaker will be Professor Peter Herman. He's going to talk about the chemistry behind emerging radiometals for theranostics.
Okay. It looks that it starts. Good morning. First, I definitely have to thanks for invitation for this conference, because normally, definitely, I will not go for medical conferences as I am chemist. And I agree to have some general introduction for the coordination chemistry. This means I will start with something what might be asked by biologists or somebody else for to chemists to do. First, there are some terms, yes, which should be known. This means first, definitely, is a structure of the complexes, because simply the structure determines the properties completely. Yes, and definitely there are some biological there are some biological properties that should be probably mainly given by structure. The second property is rate of complexation. This means how quickly, how easily the complex is formed. And definitely it is rather important for radiolabeling. Other thing is rate of decomplexation. This means how the complex is decomposed in some competing media, and this property, as it's shown here, is the most important for in vivo fate of most of complexes in the body. And finally, is a thermodynamic stability, which determines how the metal ion or ligand are selective for the partner. And again, it is rather important for radiolabeling and in vivo stability. Definitely, any metal ion requires some own ligand, and what is important is definitely kind of bound atoms. This means which donor atoms is directly bound to the metal ion. Our property is coordination number. This means how many atoms is bound to the metal ions, and to be fully for complex to be fully stable, the number of coordinated atoms should be as high as possible, and mostly as really required a particular metal ion. And definitely, again, preferred arrangement, this means structure of the complex. To have some examples, transition metal ions like copper or manganese or platinum metal ions require mostly coordination number 6 and arrangement in octahedron. Lanthanide ions mostly require coordination number 8 to 9, and the most common arrangement is antiprismatic, square antiprismatic. Low-valent metal ions, transition metals ions, require mostly soft atoms to be bound, and it is, for instance, sulfur or phosphorus, or even, for instance, for technetium, it could be carbonyls bound through carbons. And another classical example is zirconium, which has high affinity for charged oxygen atoms. And for design of the ligands, what is important is mechanism of complexation, because it determines the labeling efficiency. And for any complex, but mainly for microcycles, the mechanism is simply two-stage mechanism. In the first stage, any ligand interacts first with something what is easy to do. This means in case of macrocycles, there are pendant arms in case that they have a coordinating groups present. For instance, carboxylates in DOTA-like ligands. This complexation is fast, is in equilibrium, and only next step is the step which determines the rate and efficiency of complexation. In case of macrocycles, and again, the best example is DOTA, this step, in this step, the protons from the cycles, their protonated nitrogens, are removed, and in the same way, the metal ions go downside to nitrogens and coordinates. And this one is the final complex. And generally, as is written, this mechanism is responsible for fast or slow radio labeling. This means you can manipulate the efficiency of radio labeling through this mechanism. Theranostics. Ideal case for theranostic agents are the same elements like these classical examples, and because in that case all the complexities, therapeutic as well as imaging tracer, must be chemically absolutely identical. The slightly different case, which is commonly used now, are pairs of different elements, mostly with the same ligand, and definitely in that case, the structure might not be necessarily really the same. This means, and if you have a structure, you have a different properties and different fate in vivo. It is mainly seen in case that you have different metal ions and different ligands, but still used as a pair for diagnosis and for therapy. And as I said before, each radiometal, each metal ion mostly requires its own chelator. First pair probably that it's reasonable to talk about is copper, because it is mostly negligible pair, because people talked about yttrium or gallium more than about copper, and as we listen this week, definitely copper is much better available in this moment. This means could be possibly seen as a first real theranostic pair to be used in vivo. And, this way. Classical chelators, which could be used with no problems, are microcycles, which are shown here. And in this moment, probably NOTA is the most common first choice for most of the people, because the complexation with NOTA is fast and the complexes are reasonably stable in vivo. It should be fine for copper 64, but there are no reasonable data if it's good for copper 67, because longer half-life and probably longer, slower pharmacokinetics in case that, for instance, antibody would be used. In that case, better ligands should be suggested. The first one was suggested at 2005 by Anderson Group, and this one, this particular complex, ligand, is able of fast complexation. It is well stable in vivo and could be used and is used only by several groups. The other one, which is coming from here, from Melbourne, is used by Clarity for real theranostics or imaging, and the same complexation is fast and the complexities are stable. The other two ligands are from our lab, and as I show later, they are also rather good for this purpose. Here is a comparison of ligands or chelators used for copper labeling, and I can say that the classical ones, under the same conditions, this means conditions when intended used to show the differences, yes, are much worse than the better chelators which were suggested very recently. And with our bisphosphonates, the specific activity might be rather high, depending, of course, on labeling temperature. Reasons are structure. Here, the structure is completed with 6 nitrogen atoms. This means it is perfectly fitted copper, because copper mostly requires nitrogen donors. In our case, we have a cyclam skeleton, which again is very, very selective for copper, and due to the complexes are stable. What we added is manipulation of the mechanism of complexation. This means first we prove that this out-of-cage complex is formed first, and in the next step, the protons are removed from the cage with help of, again, oxygens or the pendant arms, because phosphorus groups are able to form very stable hydrogen bonds, and copper is transferred to the cage. Altogether means that we have rather efficient labeling. Another theranostic pair, which probably will come into clinics, into utilization, is Scandium. And again, this week we listened to several talks that was shown that Scandium should be available for use, and some specific requirements for Scandium. This means Scandium is small, and due to probably will require a little bit smaller ligand chelator cavity than the other metal ions. Because it's small and charged, probably charged oxygen donors should be those with combination with nitrogen, which will give the right, correct coordination sphere. And the most common coordination number is again 8, but it might be 7 for smaller cavity, or possibly 8, because there are some complexes with this coordination number. Classical chelators definitely is DOTA. You see here that Scandium perfectly fits to the cavity. DOTA complexes or DOTA-like ligands are, their complexes are very, very stable, and probably is the best choice in this moment. But the labeling efficiency is not the perfect. There is necessary to heat the reaction mixture, and due to it might not be very suitable for sensitive substrates. Debrecen group a year ago approximately suggested ASTA as a chelator with 7 donor sites, and it was shown that it could be labeled at room temperature. It is selective for Scandium, and it is stable in vivo. But anyway, here is structure, and there is one more coordination site filled with water. This means this ligand design again might not be the best one for longer lived isotopes like Scandium-47, because longer time circulation in vivo might be expected, and it might not be perfectly stable at that case. This means the chelators with coordination number 8 might be better. What we can do in that case? Again, we should have something more electronegative, because Scandium is small and charged. This means some oxygen donors or donors with high charge density, like our phosphorus groups or possibly phosphinoxide or pyridons, might be better. And again, we should manipulate with the mechanism of complexation. This means we tried the same way like in case of copper and previously with traps with gallium, and we tested small modification here, and we also tested the completely different ligands, how it will work. We can see that this modification, as should be expected, doesn't change anything. What happened? In that case, we had a little bit faster complexation, but there was almost no labeling with this kind of ligands. And reason might be that with large phosphorus, this cavity is already too high, too big for small scandium. But anyway, we can manipulate a little bit with structure of the complexes, and for chemical study we have to use something what could be more easily chemically followed. This means for spectrophotometry the cerium between the lanthanides is the first choice, and we used again different substituents to look for manipulation of the mechanism. This means you see big differences once we change something rather far away from coordination site, and the differences are huge, are big. Unfortunately, at least with current substituents, we were not successful with faster complexation than DOTA. But anyway, this substituent forms too stable out-of-cage complex, and due to complexation with the ligands is extremely slow. But all the others, this means this four, are forming the first out-of-cage complex with the same stability. This means there is no difference between these substituents. But once we look for the second step, which is possible to measure through chemical kinetics, we saw a big difference. This means for this kind of ligands, we should manipulate proton transfer to accelerate complexation rate. This means possibly lower temperature for labeling. What about other possible pairs? It should be lanthanides, and this set of radioisotopes has been mentioned during this week a lot of times. We should consider another mostly therapeutic radioisotopes, and I can say that because they are from the same group of metals, they should be easily interchange each other because the properties of the ligands should be more or less similar or reasonably similar. And definitely scandium could be used for pairing with any lanthanide because the complexes should be mostly similar. From our data we know that, for instance, this group accelerates a little bit the pyridine oxide, a little bit complexation of smaller metal ions in between the lanthanides. This one, which is not successful for scandium, but works rather well with lanthanides, and I will show later that is really true. But for instance, tetraamides of DOTA, which are suitable for lead, are fully non-suitable for lanthanides, again because of slow complexation. Other pairs. Katie mentioned, lead. They might be considered some other transition metals. The mercury could be considered as well, and in this moment there is no reasonable chemistry around. But what might be considered as another possibility is design of this kind, where we have two different chelators selected for each selected for one metal ion, and once the properties are rather well designed, they could be used for sequential complexation and labeling, or opposite with the other metal ions. This means it is similar approach to twin tracers that will be which well designed in Munich and are commercialized by Symptomix. This means two examples has been shown that it really works. One is ours coming from MRI contrast agents or combination that we used we used gallium and lanthanide as a gadolinium for MRI PET PET combination or single tracer, and it is given by very selective.
Can you wrap it up?
Yeah, one slide. The same was very recently presented by Munich group, where two phosphorus ligands, this one and this one, were used for selective complexation. And the reason I have already shown that this particular ligand is very selective for large trivalent metals and forms also stable complexes with bismuth, which might be alpha emitter. This means conclusions. I can say that rational design of the complexes is helpful in case there is done the right way. And for copper, in this moment, seems to me that we have good chelators for scandium and lanthanides. They probably should be found, and definitely this two chelator, two metal ion approach might be suitable. And finally, thank you for your attention. I'm sorry.
So thank you. I think since we're over,
Yeah.
if you have questions, you should catch Peter afterwards. We'll move on to our next speaker. Our next speaker will be Dr. Michelle Ma, talking about new chelators enable one-step kit-based radiosynthesis of receptor-targeted gallium-68 radiopharmaceuticals.
Okay.
Thank you.
Thank you very much, everybody, and thank you to the organisers for inviting me here today and for the kind introduction. So, following on from Professor Herman's excellent overview of the field of chelators in metal inorganic chemistry, in nuclear medicine, I want to really focus on chelators for gallium-68 and make the case as to why we really need to be focusing on developing these to simplify radiosynthetic procedures that involve these radiopharmaceuticals. So for this audience, I don't think the germanium-68, gallium-68 generator really needs an introduction, but before I go into some background, I just want to highlight a couple of things about the generator. So gallium-68 generators really enable access to PET isotopes without requirement for clinics having an on-site cyclotron or being within a geographical distribution range of a cyclotron. And I think this leads to the next question. In 10 to 15, 20 years' time, when gallium-68 supply is hopefully meeting demand, is gallium-68 going to be the PET equivalent of technetium-99m in terms of accessibility and availability? Technetium-99m is used in kits in over 30 million scans worldwide per year. So then, is peptide and protein receptor-targeted PET imaging with gallium-68 really in its infancy? And so what's around the corner for gallium-68? With the new generation of receptor-targeted drugs, be they immunotherapeutics, chemotherapeutics, or peptide receptor radionuclide therapies, what's going to happen with gallium-68 radiopharmaceuticals? Are we prepared for these very rapid advances in receptor-targeted, molecular-targeted drugs? What regulations are going to accompany gallium-68 radiopharmaceuticals in all of the different countries worldwide? In the UK, certainly since I've been in the UK over the past 6 years, we've seen a growth in the number of PET scanners. I think it's almost doubled in the past 6 to 8 years in the UK, but this has been accompanied by staffing cuts or caps on staffing costs within the NHS. So how do we effectively develop gallium-68 radiopharmaceuticals in this sort of environment? And my final point is multi-centre clinical trials, and I haven't put a question mark behind this because this is coming. Certainly within the biomarker discovery map outlined by Cancer Research UK people, this is something that has been highlighted as an issue, as a barrier to widespread implementation of molecular imaging for many molecular imaging agents, be they receptor or be they radionuclide imaging agents or be they other imaging modalities. So how can gallium-68 chelators for kit-based labelling facilitate or help us meet these challenges that are coming up. First of all, what's in a kit? Well, the kit contains a chelator bioconjugate, buffer salts, stabilisers and bulking agents, and typically they're dried down to give a lyophilized sample. So when you're formulating a gallium-68 radiopharmaceutical from a kit, ideally all you will have to do is add your gallium-68 directly from your generator into your kit. And you'll get your reaction, which ideally will occur at room temperature within the space of 1 to 2 minutes at neutral pH, ready for injection into patients after QC. Chelators will enable this. Chelators are key to these reactions, going very, very fast. And with this, we can start to meet some of these challenges. We can have fast development of new receptor-targeted radiopharmaceuticals to match developments in new therapies. We can decrease the regulatory burden at the radiosynthesis stage by very much simplifying our GMP and QC protocols. We can look at easily implementing these radiosyntheses across multiple sites, including in multi-centre clinical trials. And we can start to think about the way in which we synthesize gallium-68 radiopharmaceuticals as being very similar to the way in which we prepare technetium-99m radiopharmaceuticals, which are typically described as shake and bake. I think that's actually overly complicated for some of them, because some of them all you really have to do is actually shake. You don't even need to heat them. So where are we at the moment in terms of chelators? Well, we frequently use DOTA and HBED in our radiopharmaceuticals, gallium-68 DOTA-TATE and gallium-68 HBED PSMA. Now, DOTA-TATE requires heating and post-synthetic purification to incorporate gallium-68 into the DOTA macrocycle, which is this motif here. The post-synthetic purification is required to remove unreacted gallium-68 from our reaction vials, from our reactions. With HBED, we have this chelating motif here with 2 amines, 2 phenyl groups and 2 carboxylates. We don't actually need to heat these reactions to get our gallium-68 into solution. However, people do typically heat, because without heating, you get formation of these 2 different species in roughly a 50-50 ratio. If you heat your reaction, you favour formation of one of these species in a ratio of about 90% to 10%. So gallium-68 HBED PSMA is actually 2 different detectable species in solution. And I'll just finally go on to say that all of these radiosyntheses are undertaken at pH 3 to 5, because higher pH conditions can lead to colloid formation. These are the typical synthetic steps that one goes through when preparing these radiotracers, and you can see that there are multiple different steps along this pathway. The overall synthetic times for these species range between 10 minutes to half an hour. So before we go on to chelators in gallium-68 that are currently under development, I just want to highlight the essential chemistry. So gallium-3+ is considered a hard metal ion. It has a high charge density, meaning that it has preference for donor atoms such as nitrogen and oxygen. People will often refer to this diagram that was this speciation plot that was produced in 1996. However, there are more recent studies on the speciation of gallium-68. But the main take-home message here is that below pH 4, you get your hexahydrate gallium species that's soluble in solution. Between approximately pH 4 and 6.5, you get formation of insoluble hydroxides and other colloidal species, and these essentially remove your gallium-68 from reaction. Above pH 6.5, you get your gallate ion forming, and this is soluble again. I sometimes think that these sorts of plots are an oversimplification of what's actually happening in solution with your eluent, because you have other metal contaminants in solution, you have buffer salts, and you have different temperatures and pressures that really influence this speciation, but I won't go into that today. Could I have the next slide, please? Mouse. Oh, here we go. So, ideally, our chelators will need to compete with formation of insoluble precipitates and colloids in a kit. So the rates of reaction will ideally be diffusion controlled. We would like our reactions in kits to occur at room temperature, and we want these reactions to provide quantitative radiochemical yields at low chelator concentrations to obviate any purification protocols at the end of our radiosynthesis. And lastly, as Professor Herman described, we want a species with very high in vivo stability. But I won't go into discussions about thermodynamic and kinetic stability today. So there have been a lot of chelators that have been developed over the past 5 to 6 years for gallium-68. And I've highlighted, I think, some of the ones that have demonstrated their ability to coordinate gallium-68 at room temperature and quantitatively so at low concentrations of chelator. And they include these macrocycles NOTA, the DATA series of chelators, TRAP, and this siderophore-based FSC tris hydroxamate compound. They also include these linear species, DEDPA, HBED and HBED-CC, and the chelator that we've been looking at King's, our tris-hydroxypridinone chelator that we abbreviate as THP. A while ago as well, about 20 years ago, people were very interested in evaluating this other siderophore, desferrioxamine, for chelation of gallium-67. So we know that these chelators are capable of coordinating gallium-68 under neutral conditions, but how do they compare to each other? So we've undertaken side-by-side studies with these chelators where we've looked at evaluating them all and selecting the best ones to take forward for development of kit-based radiosynthesis. So we have compared all of these chelators here, but I'd just like to highlight that we're missing DATA, FSC and DEDPA from this series because these were not commercially available at the time. We've looked at these radiolabeling reactions under different pH values, temperatures and concentrations. This is work that a student, Maria Tsionu, did in about 4 months, and I'd just like to emphasise that each one of these data plots represents 3 true experimental triplicates, each with duplicates within each experiment, so she did an extraordinary amount of work here. I don't want to go through all of this data, I just want to highlight what we could see at pH 6.5 and 25 degrees Celsius. Under these conditions, we could see that our DFO and THP chelators at 500 nanomolar could quantitatively or near quantitatively complex all of our gallium-68 in solution, and that HBED and not P were not far behind this. So going forward, we've developed THP and looked at its kit-like one-step labelling abilities for gallium-68. We've attached our THP chelator to somatostatin receptor-targeted peptides. We've also attached it to proteins and antibodies and demonstrated that we can get labelling under these mild conditions. One can't go to extremes of pH or high temperatures for antibodies, they fall apart. And we've also looked at this to develop dendritic species as well. But the real proof, I guess, if you like, is in the PSMA pudding. And this is a derivative that a very talented PhD student, Jennifer Young, has worked on in her PhD at King's College London. And what she's done is she's attached this THP group to our PSMA-targeted pharmacophore here. She's put it into a single vial kit that contains our THP PSMA as well as sodium bicarbonate and phosphate buffer. And when she adds gallium-68 directly into this vial, she gets a reaction at about pH 6 to 7, and at room temperature in 2 to 5 minutes she gets quantitative formation of her gallium-68 THP PSMA. This is our radio HPLC trace at 26 nanomoles of our bioconjugate. She's gone through and she's done a lot of preclinical work to demonstrate that this targets PSMA expressing tumours, and this has gone all the way through into and just completed a first-in-man clinical study at the Peter MacCallum Centre, is now under evaluation in several centres in Europe. But I also, before I wrap up, how much time do I have left?
6 minutes.
Oh, wonderful. Well, you've got another 4 minutes of me then. So I wanted to spend a little bit of time now on discussing some of the other chelators that I think have really great utility for kit-based labelling and that I'm really excited about. So we highlighted, we could see that DFO, this linear siderophore, could complex gallium-68 at near neutral pH and low concentrations of chelator. And this FSC siderophore-derived chelator that's been developed by Professor De Cristoforo contains these 3 hydroxymates in a macrocycle. So any of the instability issues that DFO potentially demonstrates in vivo from the old studies with gallium-67 can be avoided by incorporating these 3 hydroxymates into a macrocycle. And certainly De Cristoforo's group has shown very nicely that this chelator radiolabels in 95% radiochemical yield at pH 4 to 5. He's also very nicely demonstrated that this particular chelator has great utility in developing either trimeric peptide species for high affinity targeting, or you can put different groups on these NH2 groups here. The DEDPA chelators, when they first were reported in, I think, about 2010, generated a huge amount of excitement. There are some issues with their biodistribution in that they are a little bit hydrophobic, so their biodistribution is not ideal, and there is some in vivo instability that Chris Orvig and colleagues have addressed by putting a cyclohexyl backbone on the end. But these are not commercially available. There have been some recent studies that demonstrate that they might have utility in hypoxia or cardiac imaging, but where these sit, I do not know. I wanted to highlight the case of HBED because I think the inorganic chemistry community has done a really, really poor job in characterising what the actual complexes are that form with gallium-3+. We've started to do a little bit of work on this. Many people talk about our HBED compound as producing diastereomers. We don't think that's the case. We think that when we react this HBED ligand with gallium-3+, that we're getting a pentadentate species and that this is in equilibrium with other species, either tetradentate or our hexadentate species. So can we do better around that? I finally just want to touch on this slide on the TRAP series of chelators that have been developed by not me, Professor Herman and Vesta, as very, very high specific activity radio tracers. They have very high in vivo stability, and you have the ability to make trimeric peptide species out of these. The gallium-3+ chemistry has been very well characterised. So whilst they may not be suitable for kit-based labelling, where you need a high specific activity tracer, where you have low concentrations of receptors in vivo, then this might be your chelator. And I wanted to finally spend an entire slide just really highlighting the utility of these new data chelators that have come out of David Parker and Frank Roche's labs in Durham and Mainz, respectively. So these data chelators contain 3 amines and 3 carboxylates. They've been attached, this particular data M chelator has been attached to octreotate. And what these researchers have very elegantly shown is that you can get kit-based or kit-like labelling with gallium-68 with a variety of gallium-68 eluates, either those that have been pre-processed or those directly from the generator, at very low concentrations of your bioconjugate, or very, very low amounts of bioconjugate. So we're tremendously excited about this work. And this is really my final slide. We sort of haven't really discussed how these chelators affect biodistribution, but this is obviously a huge part of where they need to go. So recently, we've contributed one of our THP chelators attached to 3 RGDs to this study that's been spearheaded by this PhD student, Daphne Lobick. And she's compared DOTA RGD2, TRAP RGD3, an FSC RGD3 derivative from Professor De Cristoforo and our species. And you can see that DOTA RGD and TRAP RGD species have very, very nice biodistribution. They're accumulating in the tumour. They're being excreted renally through the kidneys, whereas the FSC compounds and the THP compounds are getting a little bit stuck in the liver, and you have higher kidney retention. And so this is why I'm particularly excited about the data chelators, because it combines these nice hydrophilic chelators, but with the ability for one-step kit-based labelling. So a very brief summary. New chelator technology is already enabling gallium-68 kit-based labelling. I hope that this technology has the potential to simplify implementation and routine production of gallium-68 radiopharmaceuticals, and that this in turn will lead to widespread access to peptide receptor-based PET imaging for the benefit of more patients. Thank you very much.
So thank you. You managed to use all of your time. So congratulations.
Sure.